Infection is something that plagues all of us, and no matter what surgical specialty we're in. The size of wound complications and surgical incision problems is astronomical. We talk about a wound complication that needs a dressing versus a wound complication that needs to go to the operating room. They're all wound complications.
Surgical outcomes are a big cause of complications postoperatively. It's responsible for 26% of the readmissions for patients, and it has a huge economic burden on a healthcare system.
It can be life-threatening. It can be related to sepsis. And even when you have it and it's controllable, manageable, it's still a big trail for the patient.
It is imperative to communicate in a generic way about wound complication because every surgical procedure starts with an incision. An incision cuts through skin first in every type of procedure. So that is something that all procedures have in common. So you want to know dehiscence, infection, seroma, and hematoma across the different procedures, different surgeons, different disciplines, but certainly across hospitals.
And these complications, sometimes they're very simple to resolve, sometimes they're really not. We don't have a standardized classification or a standardized way of even collecting information about patients that are suffering from these complications. So really what it means is that we don't have a great way of dealing with it.
Effectively, there are 4 areas where we have concern with a wound. One is dehiscence, that's the opening up of the wound. Infection, seroma, that's where fluid collects around a wound, or hematoma, the bruising or bleeding into the wound afterwards. Those 4 areas can cause real problems if they're left unchecked and can get out of hand.
So I think it's about improving everybody's understanding that a red wound isn't necessarily going to be an infection. Could be the start of dehiscence, or it could be inflammation, could be seroma, it could be hematoma. However, the problem is when these patients present at their primary clinics, at their general practitioner, they're often prescribed antimicrobials, and that could be because the doctor thinks it's an infection or they want to prevent an infection from occurring. So it's really important that we understand that you look at the wound carefully and try to categorize it, but we need to be a bit more specific about what it is and how we're going to treat it.
Once you come up with a standard around, how to treat surgical site outcomes, you have to disseminate that. There's no more efficient and suitable way to do that than through digital. Having Johnson & Johnson support it as a sort of a global endeavor that we take on makes me personally proud, and surgeons have also said that they appreciate that we've been working with them on this.
So working with other infection prevention nurses and epidemiologists, we are focusing on trying to make sure the entire team are all working together to drive these infections down. Ideally, we don't want to see a single infection. Reality, we're going to see 1 or 2, but we can do better than what we're doing today.